Hydroxocobalamin is commonly known as Cyanokit that you purchase for cyanide poisonings, and this is the antidote for it. It is a vitamin B12 derivative, if you will. It's commonly known as vitamin B12A. The way it works, it binds with cyanide in the blood and on the cells and forms cyanocobalamin, which is harmless and then easily excreted renally and through the urine. So it is kind of the newer way to treat cyanide poisonings versus using the older way of amyl nitrate, sodium nitrite, and sodium thiosulfate. Pregnancy class for this is C. Indications, cyanide poisoning. Contraindications, none really in our settings. Adverse reactions to watch for: hypertension, that's going to be the biggest one. It can cause some hypertension. Nausea, vomiting, GI bleeding, shortness of breath, some indigestion, dizziness, and headache. So something we do want to keep in mind whenever we give this, it's safest just to use a separate IV line that you're not giving other medicines through. Either that or make sure you're fleshing it out real good and separating it with time between different medicines. Typical adult dosing is going to be 5 grams IV or IO over 15 minutes, and you may repeat it once, so a maximum of 10 grams. Pediatric dosing is going to be 70 milligrams per kilogram IV or IO over 15 minutes as well, and then repeated once if necessary. Starts working pretty quickly, less than a minute usually. Peak effects within 8 to 10 minutes, and the duration varies, depends on how severe the symptoms are and how well you have renal function, all that good stuff. Special considerations, the only thing to note, it does cause a lot of hypertension, so seeing a blood pressure above like 180 over 110 is pretty common. Just keep in mind though that it usually will return to a baseline and that blood pressure will come down within about 4 hours. So like I said, this is kind of the newer way of treating cyanide poisonings, and it's a safer way than doing the other 3-step process with the amyl nitrites and sodiums.